Pay attention, but you can also check us out on our website, centralfloridaveterinarycardiology.com, to learn about many other heart conditions that affect pets. And if you ever need to contact us, our phone number is on the website, and we'd be happy to take care of your pet. Dr. Bolfer is extremely experienced in all matters relating to pet hearts, and we would be happy to see you. Okay, so are you guys ready? It doesn't involve a lot of juggling, but it does involve this sweet girl, okay? So we're gonna get started.
Okay, so as Lillian was saying, this is obviously one of those situations where you believe your dog just underwent a cardiac arrest. That's what we call when their heart stops beating, or if they have like a syncopal episode and their heart rates are very, very slow and you can barely feel it. If you are far from an emergency clinic, there are a couple of things that you can do at home. Okay, so the very first thing would be obviously your dog's going to be most likely lateral, what we call lateral recumbent. So it's laying on the side. It's important for you to put your dog on either side, either right side or the left side. Studies show that it doesn't really matter which side it is, not on their back, not on their sternum, because that's not the most efficient way for you to do what we call the cardiac massage. Okay, so let's see how we do it here. So let's lay down. Hi, beautiful. Yeah, you want to lay down? Like that is fine. Yes, you can lay down right there. Okay, so let's assume here that Bailey just had a cardiovascular event. So essentially, you cannot feel pulses, and she's completely unresponsive to you. Apparently no chest movement, so there's no breathing. The most important thing is really cardiac massage. Okay, the way that you do that, and the way that it's best to do, is you can position behind your dog's back. So with your knee, you can actually hold against their body. So when you do the massage, you can massage kind of towards you, so that the dog is not going to move away from you, and you do a much better job in massaging their heart. Another very important thing is the size of your dog. That's obviously several different sizes. For dogs like Bailey, her size, for instance, the best way or the best location for a chest massage is over the widest portion of the chest, and not really looking for where the heart is. The widest portion of the chest is where you're going to have most of the impact in massaging, actually changing the pressures inside the chest and squeezing the heart for that blood to kind of move forward. Now, if you have little dogs or smaller dogs, you might want to really massage right over where the heart is. For you to know exactly where the heart is, one rule of thumb is that you can flex their leg where the elbow touches the chest is most likely where the heart is going to be. Okay, so smaller dogs, your Chihuahua, your little Pinscher and Shih Tzu, Lhasa Apso, etc. Just flex their elbow here towards the chest. Where the elbow touches the chest is most likely where the heart is going to be, and that's where you want to do your massage. Otherwise, larger dogs, the widest portion of the chest. The best way for you to do is that with your dominant hand, you want to grab a little bit of their skin for leverage, put your other hand on top, keep your elbows straight and fixed, and you're gonna press down. Ideally, about 1/3 of the width of the chest. Obviously, we don't know exactly what 1/3 would be, but just know that it's very hard, okay? And it's very deep. We say press deep and press fast. The speed of which you have to do chest compressions is about 100 beats per minute. Obviously, sometimes it's very difficult for you to do that, and you're very nervous and you're afraid of what's going on. One rule of thumb is to sing the Stay Alive song from Bee Gees. So Staying Alive and Stay Alive, the beat of that song is going to be mostly around 100 beats per minute, okay? So again, you have your elbows fixed in position, you have the skin for leverage, so you can bring the skin a little bit up and press deep, press fast, and press hard, okay? That's your chest compressions, 100 beats per minute, okay? We normally do that between 2 minutes and 3 minutes at a time, and then we change people around so that you don't get tired, because when you get tired, you start leaning off and your compressions will be not excellent, okay? And you want to do that and change maybe every 2 minutes or so. Do your chest compressions, keep doing your chest compressions until you see that there is any response or any coming back, or maybe you can feel now the heart racing and beating underneath your hand here, okay? As far as ventilation, chest compressions by far is most important for you to keep that heart going. There is a mouth to snout technique that you can do where you can blow air through their nose. If you ever need to do that, normally we try to intercalate 30 chest compressions with one breathing, and then and go back to 30 chest compressions and 1 breathing. The way that you do that, you just move their face up here, and you just close their mouth, and you just blow through the nose very strong. And you see the chest is going to expand a little bit. When you do that, go back to your chest compressions, okay? So again, that's just a one little technique that you guys can all do at home if something happens. Hopefully it's never gonna happen to you. And again, remember that the best thing for you to do if your dog collapses and is unresponsible is to rush your dog to a veterinary emergency clinic. So we can do this for you, okay? With a lot of people involved. We can intubate and give them oxygen therapy. We can give them injections in the vein that is gonna try to restart the heart. So they will have much better chances in a hospital setting, but in a outpatient, out hospital settings, this is how you should be doing. Okay, guys? All right, enjoy the rest of the day.
Thank you guys so much, and thank you to our sweet girl here for demonstrating so peacefully. We do have a booth in the back in case you guys would like to stop by. We have some extra Halloween candy and some little treats for your pets, as well as some brochures for us. And something that you don't know about Dr. Bolfer is that he is also a private pilot, and he uses his pilot's license to fly charity flights for Pilots and Paws, an organization that connects private pilots with rescue organizations. So we fly the plane to the pets from kill shelters, from high-risk pets about to be euthanized, and we take them back to a foster rescue on their freedom flight home. So Dr. Bolfer, in addition to being a fantastic cardiologist for Central Florida, is also our pilot in residence for rescuing pets. We thank you guys so much for watching our demonstration here today, and then if you'd like to stop by and come say hi, we're right back there. Thank you.